Well, actually, the very first thing they had to do was all the 5S. That was one thing that we found was a necessity.
Yes.
They had to know what supplies they had, where they were. There was a lot of searching for inventory. It was just very obvious that that needed
a
to
lot
be
of time
first.
was being spent throughout the process of clinic. If a provider needed something for a patient care, where was that item located, and finding it. And so we really went through the clinic and tried to relocate things where it would make a little bit more sense or where they were more accessible. We leaned out the rooms a lot so that there wasn't a lot of excess supplies, but there were the things that they needed most frequently.
We are the pilot group, and so we feel like we've made a lot of progress, and we're going to be rolling it out to our other providers here in the clinic to help with the other physician MA teams. And we also have an LVN who helps with phone calls in between times, will interrupt us if we have an urgent call or something we might need. So I think the flow is going very well. First of all, we, at the very first of the day, go over a list of the patients that are coming and kind of do a pre-clinic huddle where we see what patients are going to need. I have done a review of my patients the day before or something and look to see what they're going to need. And Angela then is prepared to already do the finger sticks, the A1Cs, an INR. If there's a particular concern about medications or blood pressure check, she does that. And we just go over and prepare for the day. And as we work as a team, then we're able to cut off some of the waiting for the patient. So the patient usually doesn't have to wait in the room. It's bad if the patient has to wait in the waiting room or if they have to wait in the room. There's not much difference. They're still waiting. Mm-hmm. So our goal is to see the patient within 5 or 10 minutes of their appointment time, do whatever we need to. Sometimes they take a little longer than we expected. But that's face-to-face time with the doctor, so that's fine. I haven't seen any comments about having to wait in the clinic at all.
That has improved.
I think that absolutely has improved. This is a good model, and then we're going to roll it out with the other physician and MAs just to see how it's working. And I'm sure there's always going to be a range of wait times. Some are going to be a little more likely to talk and stay in the exam room a little longer, and some are. And I have a lot of experience, so I should be a little faster than our residents and our younger physicians. On the other hand, I think this model should help us to have the patients not have to wait as much.